Hello friends, today we are going to study and learn the pathology of edema and effusion. Friends, I can definitely say you the one thing, that if you are dedicating next 10 to 15 minutes with full heart and mind, then after this, when you will look at the Robins, it will be very easy to understand the edema from that. And you will think, I have learned this all things very easily. So let's start. First see, what is edema and effusion? Edema is the collection of fluid within the body tissue, right? And effusion is collection of the fluid in body cavities like pleural cavity, peritoneal cavity, pericardial cavity. Now when this edema and effusion occur, there are three conditions at which there will be edema or effusion. When there is disturbance in cardiac function, renal function or hepatic function, then you will see edema or effusion. Normally, what happens that at the arterial end, due to high hydrostatic pressure, there will be outflux of water and salts. And at venous end, due to high oncotic pressure, there will be re-entry of that water and salts. If some amount of water or salt will remain in the extravascular space, it will be carried back by the lymphatic drainage system. So, due to this normal balance between hydrostatic pressure and oncotic pressure, and with the help of lymphatic system, our tissue is kept dry and they get all nourishment and can give away their waste product. But when this system is disturbed, there occurs edema or effusion. This edema can be inflammatory or non-inflammatory. See, inflammatory fluid will be known as exudate and that non-inflammatory will be known as transudate. Due to inflammation, the permeability of our vascular membrane will be disturbed. Hence, protein will also move out of the vessels. So that fluid will be rich in protein. Whereas, as there is no inflammation, there is no change in the permeability of vascular membrane. So, non-inflammatory transudate will be poor in protein content. Due to this protein, the color of this exudate will be milky, whereas transudate color will be translucent, that is semi-transparent. In exudate, sometimes white cells will also be present. So now let's look at the causes of edema. Friends, let's look at the reasons which were preventing our edema in normal condition. There was a balance between hydrostatic pressure and oncotic pressure, which was at the arterial and venous level respectively. And whatever the small mistakes were remaining, they were cleared by our lymphatic system. So, when there is a fight in this system, in this balance, there is going to edema. So, that is when there is increased hydrostatic pressure at arterial end. It will push more water outside the vessel. Another reason is decreased oncotic pressure at the venous level. That is, if oncotic pressure is reduced, there will be the attraction which will be reduced for salts and water. And the lymphatic obstruction, if occurs, it will not be able to clear out the remaining fluid. Let's look at this cause in a bit detail. How there occurs increased hydrostatic pressure? It can occur when there is impairment in venous return. See, this venous return can be impaired as localized or at a large level and spread. For example, when there is a thrombosis formation in a particular vein, then there is obstruction at that level only. So, edema will be localized. Another reason is if there is compression of vein due to high external mass, then it will impair the venous return and will cause increased hydrostatic pressure. But what will happen when there is cardiac failure? There will be stasis of blood in all the veins. Hence, what will happen? There will be edema at many places of our body. So, it is localized and spread. Now, another is decreased oncotic pressure. We know one thing very well, that albumin plays a very important role in oncotic pressure. Now what will happen if this albumin is reduced? Now you will ask me how this albumin will be reduced. There can be decreased synthesis of albumin or increased excretion of albumin, right? The decreased synthesis can be because of disturbed liver function. For example, when the liver is disturbed, how it will form albumin? And without albumin or reduced albumin, oncotic pressure will be low. Another reason is protein malnutrition. That is when liver is functioning properly, but it does not have the required amino acid to make the albumin. How it is possible for the liver to make albumin? So, due to these two reasons or many more, there will be decreased synthesis of albumin. The most common reason of increased excretion of albumin is nephrotic syndrome. In this syndrome, the glomerular capillaries will allow our albumin to get excreted in the urine, and hence we will feel shortage of albumin. Due to this shortage of albumin, oncotic pressure will be reduced, hence it will promote edema. Now, due to this edema, the blood volume which should be within the vessels is now out of the vessels, hence our blood volume is decreased. Due to this, the perfusion to all the tissues will also be reduced as blood volume itself has been reduced. Hence, our kidney will also feel hypoperfusion. So it will think, oh, our blood pressure is reduced. Let me activate RAS system, that is renin-angiotensin-aldosterone system. Now due to this system, what will happen? Due to angiotensin, our vascular tone will increase. Due to this aldosterone, sodium and water retention will increase, and antidiuretic hormone secretion will also be increased. All these things will promote increase in blood volume, hence increase in renal perfusion. Sometimes hyperaldosteronism also occurs. But the actual thing is what? There is just merely increase in water, but we are not getting our albumin back. So this will cause further increase in hydrostatic pressure and further decrease in oncotic pressure, which will further promote more edema. Now let's look at the third reason, that is lymphatic obstruction. When there is trauma, which can be due to post-surgery or post-irradiation or due to inflammation, there will be disruption of lymphatic vessel. It can also occur due to development of fibrosis or tumor within the vessels. Hence, there will be impairment of the vessel to get the interstitial fluid back. Hence, it will cause lymphedema. An example is filariasis, in which there is fibrosis of lymphatic vessels and lymph node of lower compartment of our body. Hence, there is development of edema in the external genitalia and lower limb, which can lead to elephantiasis. Another example is when there is surgical removal of breast and axillary lymph node, it leads to severe edema of upper limb. So friends, in this video we have studied the pathology of edema and causes of it. In next video we'll learn the morphology and the clinical features.